If anyone here and can hear me, please say hello in the chat box so I can see who's here. Oh, Al, hey, you are here. How nice. Okay, I'm gonna wait for people to get on here. I'll be right back. I wish it was an interactive kind of webinar where I could talk to people and people could chime in. That would have been so great. So. Hi, Francine. Type something in the chat. I want to make sure that I can see it, please. Al, Francine, anyone there? Awesome. Hi, Al. I love it. Thank you. It's so sweet. I'm hoping more people will get on here. So I'll wait a couple more minutes and then we'll start. How's your day, anyways? Al, are you in San Diego? Yes, this definitely will be recorded for viewing later. Yeah, absolutely. But I do like to have people on here, so I feel like I'm talking not just to myself. But this will be recorded, and this is recorded actually, and this will be online as well. Yes. Oh, awesome. Great. So what I'm going to do is I'm just going to go ahead and start. I'm going to share my slides here. Nope. Just making sure it's the right one. Yeah, perfect. Can you see my slides okay? And you can hear me okay too? Just want to make sure everybody can see and hear well. Just type, yes, perfect. Thank you. Awesome. Okay, so I'm just going to go ahead and start. And I'm really excited to have you here. So we are going to be talking about thyroid health, which is a topic that's very dear to my heart because I will share a little bit of my story down during this webinar as well. So stay tuned. And let's get started. So first of all, thank you so much for being here. I'm really excited to share this and do that and teach others about thyroid health because so many people are not well and they have no idea why. And that's one of the main reasons why people are not well, whether they're weight their weight is fluctuating, they're tired, their hair is falling out, they can't sleep, or they sleep too much and they're still tired. But we will talk about that. So let's dive in. But before we get started, I wanted to let you know that at the end of this webinar, there's going to be a little offer for you guys. So stay until the end and for your special one-on-one invite, okay? So let's get started. We're going to be talking about the real reason why you cannot conquer your thyroid hormone imbalance symptoms. And thyroid is our main gland for our metabolism and so many other functions in our body. So if you have been diagnosed with hypothyroidism, Hashimoto's thyroiditis, goiter, hyperthyroidism, Graves' disease, thyroid nodules, thyroid cancer, and any of these, you're definitely in the right place. Also, if you are struggling with symptoms such as weight gain, puffy face, fatigue, anxiety, depression, mood swings, night sweats, brain fog, hair loss, memory loss, libido that is low, constipation, headaches, insomnia, skin changes, joint pain, and so many more others. But if you're struggling with any of these symptoms, you are definitely in the right place. So stay until the end. It's going to be a good little presentation, okay? So as you know, the thyroid is our butterfly shape that's based in the neck, and it is responsible for so many functions of our metabolism and so many other functions, of course. You can have it from a young age to pretty much any age, actually, men and women alike, mostly women and mid-aged women, but I will talk about that more, but stay until the end. Again, we're going to be discussing ways to overcome thyroid issues, and I'm going to be sharing my story as well. So stay until the end. And if you can, turn your phones off, put it on airplane mode or quiet, and just really pay attention to this conversation, okay? And then if you have any questions, there is a little chat box on the right, so feel free to type in your questions. I'm happy to answer, but if you can wait until the end, that would be great. So we will do some Q&A at the end, all right? So let's dive in. So a little bit about me. I've been working in my medical practice for about 14 years, and I started with a generalized practice. I was actually in nursing school at first, and then I went into Chinese medicine after I went to pre-med, and really realized that I can't just do it all and treat everything at once because it really doesn't work well. And so I chose an area where I really am passionate about, and I started working with athletes, being a triathlete myself, and women and men who train a lot. And for women, a lot of them either have lost their menstrual cycle or suffer from complete hormone imbalance. And so I started seeing more and more of those cases, and people who are just not feeling like themselves. And they're tired, they can't lose weight no matter what they do. And basically, I've heard it all, I've seen it all. And I was one of these patients myself, and that was not fun. And I'll tell you a little bit about my story in short, but I've been doing triathlons for a long time, and I've been doing Ironman. I've done an Ironman a year and a half, a little bit over a year ago, actually. And with triathlons, you train a lot. You should be sleeping a lot, but if you're training a lot and you're swimming, biking, running, lifting, and you're not really paying attention to how you're eating or what you're doing, and you're just training, your body completely gets out of whack. And that's what happened to me too. But basically, I didn't know I had a thyroid problem until I just one day I hit a wall and I couldn't get up properly, and even after 14 hours of sleep. And I gained so much weight overnight, and it was like my world has crushed. I was devastated, and I had no idea what was going on, and no doctor could really figure it out because the lab tests came back pretty normal. And I mean normal in Western medicine, not functional medicine terms, which we will be discussing as well tonight. But I didn't even, my menstrual cycle stopped. My weight was fluctuating like crazy. I was puffy. And I was just not happy. And I knew I wasn't depressed. And even though doctors were like, you should be on this antidepressant medication. And I said, no way, I'm a happy person. I'm not depressed. I'm not going on that. There's something deeper than just gaining weight and being depressed. It's not that. There's got to be something deeper than that. So I did go and see an acupuncturist as well and a functional medicine doctor, and did proper lab testing and food allergy testing, and changed everything I was doing, changed my diet, changed my lifestyle completely. And then I started racing triathlons more, and I actually lost so much weight just doing the right things with nutrition and supplements, and getting the proper sleep, and really taking care of my gut, my thyroid, my adrenals, and everything around it that affected my body. So really has changed my life, and this is why I'm here, to help others who are struggling. And I see it every day with my patients, and just in general, I see it so much that people are struggling and they have no idea why, because Western medicine has not gotten down to the root cause of it. And so I am here to help you fix the root cause. And it's not fun to suffer from anxiety and mood swings and weight gain. I mean, it's debilitating, and it's not fun, and it can be devastating for a lot of people, like it was for me. So I never want to see anyone struggle, and this is why I'm here. But you really have to find out the root cause, and you really have to treat it properly from every direction, and that's where functional medicine comes in play. So like I said, a lot of people are coming in and they're just not feeling like themselves, and that's what they complain about. And I could see an underlying thread that ties these people, especially these women, together, and this is why I'm here. So the three main reasons, or the three main things that I've learned being in practice in the last 14 years and more, is that thyroid issues are often they get dismissed, right? It's all in our head, just like these doctors told me, you're depressed, it's just in your mind, it's psychological. And I said, no, it's not. There's something really deeper than that. So most physicians just dismiss thyroid symptoms because they see normal labs, even though your TSH is off, your T3, T4, whatever, might be off a little bit. For them, it's normal, so they just dismiss it and say, go home, you're fine, or take an antidepressant medication. And then women are told just to deal with it. They're getting old, or men. And often women and men alike leave their physician's office feeling really demoralized and unheard, and often with a prescription for antidepressants. Like I had that experience, and it was not a good experience. So I've never taken those drugs and never recommend taking them, especially if that's not the reasons why you're not feeling well and gaining weight or feeling tired, or whichever the symptoms might be. So antidepressant is not the solution here, okay? Number two, comprehensive testing is not offered by mainstream medicine. I often see my patients getting just a TSH done, and that's not a comprehensive test at all. You want to get a complete comprehensive thyroid panel, and that is it's more of a sensitive type of lab testing, and that can reveal a lot deeper than just your TSH, and it could be actually telling what's going on in your body. And that's just one test to get. That's just one comprehensive test to get. There are other tests to find the root cause, okay? And then, of course, women who, a lot of people have the anxiety, the depression, and some people who do suffer from menopause and perimenopause will suffer those issues. And a lot of times the subclinical thyroid or hypothyroidism is really a real deal. Like I said, symptoms will be a big deal that we have to look at. So if you are gaining weight, if you are depressed, if you're anxious, if you have night sweats, hot flashes, whatever it is, and your periods have stopped, if they tell you you're in menopause, definitely do more testing, because it's crucial to really find the root cause. So, if you're leaving your doctor's office and you're unhappy, definitely go see a functional medicine doctor. I can help. This is what I do. This is what I love to do. And treating the root cause is key. And then once you fix the root cause, the thyroid, whatever it is that's ailing you, then complete balance can be achieved. And then you're feeling so much better. And I mean so much better. So Again, let's make sure you're in the right place. If you're suffering from any of these symptoms like weight gain, puffy face, anxiety, depression, low libido, which is a big deal too in thyroid patients, and I see it every day with my patients that are coming in for hypothyroidism or adrenal burnout. Libido is one of them. And of course, memory, foggy headedness, I see that so much, joint pain, fibromyalgia, also irregular heartbeat, because your thyroid can be either too slow or too hyper, and that can affect your heart beat as well. And if it's hyper, and we'll talk about that, you can have more irregular heartbeats. It can also happen with hypothyroidism. So if you are here and you have any of those symptoms, definitely stay tuned. So what does thyroid hormone imbalance entail? As you know, our thyroid regulates our metabolism. It is the butterfly-shaped gland that's in our neck. And our thyroid regulates our hormones, our energy, our sleep, mood, sex drive, weight, menstrual cycle, skin, hair, and so much more. So it's a big deal to make sure that your thyroid is functioning properly. Okay. So just to kind of basically go over what's going on in your body, we have the pituitary gland and the hypothalamus, which are the master glands, and they both control the thyroid. And so when your thyroid hormone level drops, your hypothalamus releases TRH, which is the thyroid releasing hormone, which then alerts the pituitary to produce the thyroid stimulating hormone, the TSH, and that response produces a chain of events that basically to produce more hormones, right? So the two main hormones of the thyroid are T3 and T4, right? So TSH produces T3, T4, and T4 is mostly the prevalent one, but it's inactive, whereas T3 is the actual active thyroid hormone. So T4 has to convert to T3 to be active. I see a lot of patients who are on thyroxine, which is T4, and they're not getting any results, unfortunately. And that's usually either because their liver is not functioning well or because their body is not converting T4 to T3 to make it active. So something to think about, and also we'll discuss that. So T3, T4, you always have to get those tests. Make sure it's not just a TSH, it's T3 and T4. And of course, as we know, hormones are a sophisticated chemical messenger. They all work together and they all interconnect in our body. And every biological process is relying on the thyroid to function, right? So our thyroid is to achieve a proper thyroid balance, you have to properly eat, exercise, make sure you're not exposed to toxins. And my God, we are all exposed to toxins from our environment and what we eat, what we put on our skin, what we breathe, what we get injected with. So everything is contributing to our thyroid. And of course, our stress levels, that's a big deal, and that's going to affect your thyroid no matter what. High stress is not a happy thing for our body because it can produce too much cortisol, which can then really exhaust our adrenals and affect our thyroid alike. So make sure you always pay attention to your food, and we'll talk about that briefly as well, or sleep, exercise, toxins, and so on, okay? Of course, hormone imbalance occurs when you have too much or too little of a hormone. So if you have too little TSH or too much T3, T4, you're going to have hyperthyroidism. If you have, possibly, right? If you have too much TSH, too little T3, T4, you're going to see hypothyroidism, and hypo is an under-functioning thyroid. So, so most women I've treated, and men as well, like I've mentioned, have come to me misdiagnosed. And the more you prolong a misdiagnosis of a thyroid imbalance, the worse it can get. That's why if you're feeling symptoms and if you're going to your doctor and they're telling you that it's all in your head, run. Go see a practitioner that is more holistic and will listen to you and will really take care of the root cause and will actually pay attention to what's really going on and do the proper testing, because it is treatable. and we can help. So let's find out the types of hormone imbalance, thyroid hormone imbalance. So with hypothyroidism, which is very, very common, you're going to also see fatigue and sluggishness, sensitivity to cold, constipation, dry skin that can be very pale as well, puffy face, puffy tongue, weight gain that can be creeping on you overnight pretty much, weakness in your muscles, depression, memory issues, foggy headed, and all these main issues, main symptoms can be symptoms of hypothyroidism, which is an under functioning thyroid. And as I said, the thyroid plays a main role in your brain as well as your metabolism, right? And it regulates your energy levels. So if your T4 doesn't convert to T3, which, like I mentioned, your liver has to be functioning properly to convert it. So if your liver is not happy, if your liver is not healthy, if it's not detoxifying properly, because either you have MTHFR, which is a genetic mutation that you can't methylate properly, for example, or you're drinking too much alcohol, or you have fatty liver, or other causes that can cause an unhealthy functioning liver, then your thyroid won't function well. That's why I always start my programs with detox, because you want to reset your liver to then reset your hormones and your thyroid as well. And also, if you have a leaky gut, then, and leaky gut is when your pores of your gut are they're porous. They're not properly aligned or properly, how should I say it? I'm forgetting the words right now, but the gut is not functioning well. So foods and particles are escaping and they're going into your bloodstream and creating an autoimmune disorder or other issues. But leaky gut will also cause less serotonin and less GABA, which are amino acids for neurotransmitters. And then you can have more depression and anxiety. So liver and gut play a huge role in your thyroid health, huge role. And that also plays a huge role in your depression and anxiety, right? So if you're depressed, if you're anxious, it might be your thyroid, sure. But you also must look at your liver and your gut health, because if you're not, and then you can't really treat the root cause. So every cell of our body needs your thyroid hormone to function, but also every cell of our body needs our healthy gut. 80% of our immune system resides in the gut. So make sure your gut is healthy, and you can tell if your gut is unhealthy, if you have autoimmune disorders, if you're constantly bloated or constipation or have diarrhea, if you can't sleep well, if your energy is not good, if your skin is breaking out, that's mostly leaky gut. And there's so many other causes and so many other symptoms for leaky gut. So gut and liver are huge key for thyroid health, okay? I hope this helps, and I hope this all makes sense. And then, of course, with hypothyroidism, we have Hashimoto's thyroiditis, which is an autoimmune disorder. And it's very similar to thyroid or hypothyroidism, only the only way to make a differentiation here is by testing for antibodies in your body, in your blood, and like TG and TPO, which will go through those blood tests. So if you have antibodies that show hypothyroidism or Hashimoto's, then you have an autoimmune disorder, and that's inflammation, which we want to attack. And these symptoms will be very similar, if not the same, to a hypothyroidism. Hashimoto's can come and go, so you can be great at one point and you can be horrible at another day. So stress plays a huge role, inflammation. You can suffer from joint pain and stiffness and muscle weakness again. And of course, if you have Hashimoto's and hypothyroidism, your menstrual cycle can also be causing either amenorrhea, so no menses, or complete long menstrual bleeding and losing a lot of blood, and then anemia and so on and so forth. So pay attention to that. So hypothyroidism and Hashimoto's, autoimmune and underactive, very common thyroid problems. So as I mentioned, if you do not take care of your thyroid, and if Hashimoto is left untreated, and that's what I had Hashimoto's, and I didn't know it, and I didn't know it for a long time, and I had to reverse everything and take really good care of myself, which I do every single day. So if Hashimoto's is untreated, and if hypothyroidism is untreated, then you can suffer from goiter, which is an enlarged thyroid, right? And cardiovascular problems. So and this is really interesting, a lot of people will come in with high cholesterol and they will have no idea that their thyroid is actually off. So if you have hypothyroidism, most likely you will have a higher cholesterol levels so your lipids, right, your LDL. So don't just check your cholesterol, check your thyroid, and do not let them put you on statins. That's not a solution. You want to make sure your thyroid is working properly, so you're not getting on just another medication that can destroy your heart, and can create a lot of side effects down the road. So make sure you take care of your thyroid, to take care of your cardiovascular, okay, and cholesterol. If you don't take care of your thyroid, you can also have severe depression and anxiety. Not fun. So definitely take care of all these as well. And then mixed edema, which can be life-threatening, and that can cause lethargy and unconsciousness as well. So make sure you take care of your thyroid, okay? And of course, the less common, but still common, is overactive thyroid, which is hyperthyroidism, which your body produces too much of that T4 or thyroxine, right? And then hyperthyroidism will accelerate your body's metabolism and create a lot of heart palpitations, more anxiety, sweating, night sweats, difficulty sleeping, difficulty concentrating. Can have the complete opposite effect of actually weight loss and diarrhea, more diarrhea. And then, of course, it can also cause amenorrhea or no menstrual cycle instead of the other way around. Tremors, shaking, irritability, nervousness. So that can also be caused by hyperthyroidism and overactive thyroid. So pay attention to that as well if you have any of those symptoms. Oh, I can see. Okay, so is any of this relatable to you? And if it is, definitely speak with me. I'm happy to help, and we'll talk about that in a little bit. But if these symptoms if you're relating to these symptoms and they are annoying to you, there's definitely things that we can do. And as I mentioned, with hyperthyroidism, again, you can have Graves' disease, which is the overproduction of thyroid hormones. And again, those symptoms of heat sensitivity, weight loss, irritability, complete fire person, like we call it in Chinese medicine as well. So we want to cool the heat, we want to lower the inflammation, we want to calm the person down a little bit and basically balance them. So now that you have a little better understanding about the thyroid and how it works and the different diagnoses of thyroid, hypo and hyper, and a lot of people think they can't do anything about it, but you definitely can. Make sure you see the proper practitioner, of course, but there is a lot of reasons why things haven't worked in the past. And if you tried over-the-counter supplements or something that's not your body doesn't really care for, don't do that. Over-the-counter supplements without the, I don't want to say prescription, but without the suggestion or, okay, let's say prescription of a health practitioner that can guide you, a guidance, that's it. That can do detrimental effects, because I see a lot of people trying weight loss pills, even though their thyroid is off, and that completely messes up their bodies, and it can cause irregular heartbeats and heart issues, and then it can really mess up your metabolism. Also, don't try and starve yourself. That's not a solution. That's actually going to create a slower metabolism. So let's talk about what and how to get your thyroid in shape. Okay, so number one thing, be proactive about your health, and believe you can get the help from a practitioner, from a wellness practitioner, from a functional medicine doctor, and make sure you find out the root cause of your symptoms and get the proper testing. As I mentioned, that's really, really crucial. So get a thyroid panel that includes the TSH, free T3, free T4, reverse T3, TPOs antibodies, and TG antibodies. These are the important ones for thyroid, to really get a full thyroid panel. And then make sure you take action and you heal and you can live the best life. Okay. And functional medicine is really the key, because we are patient-centered, care focused. So, when I was that patient years ago, I went to the doctor and they gave me 2 minutes of their time, maybe, if I was lucky. And they heard me say I'm tired or not feeling well or depressed or whatever, and they just gave me medication right away. They didn't ask any questions. And that's when I knew red flag. That's what I wanted to practice holistic medicine, because I knew there was so much more to really talking to a patient and really listening to them and hearing them out, which is key. So I'm not saying all Western doctors are like that. Absolutely not. I love Western doctors. They are here to help, but they are, short on time most of the time. And a lot of times they just are there to prescribe medications and not really hear you out, unfortunately. So make sure you got the right practitioner. And then do the labs, the proper labs, the nutrition, take care of your lifestyle, toxins. So in my detox program, I actually talk about environmental toxins, which is key actually, to reduce your toxin overload internally and externally. So let's say detergents, right? So laundry detergents, which is a huge thing, which you never want to use Tide or any of those regular commercial detergents, because they are harmful. You breathe them, they're on your clothes, they're everywhere in your house, they're in your sheets, you inhale them, you breathe them, that's toxic, that is carcinogenic, that can be fertility problems and other health issues, as well as allergies. So definitely, like, for example, laundry detergent, switch that. Make sure you use natural cleaners to clean your house, use essential oils. That's my favorite thing. And make sure you take your mitochondria, take care of your mitochondria, which is where your ATP, your production of energy, is being created, right? And there are certain supplements, and I can help with all that. Make sure your immune system is strong. Make sure your inflammation is low. So nutrition is key. Plant-based diet is definitely by far my favorite way to do it. At least, you can add seafood and stuff, but no dairy, lowering inflammatory foods is key. Taking the right supplement is key. Proper sleep, proper immune balance, making sure you get plenty of sunshine without the toxic chemicals on your skin. Get a natural coconut sunscreen with zinc, right? So get sunshine, get plenty of sleep. Make sure you're emotionally happy. Be around happy people that don't bring you down and don't weigh you down or drain you. And if something is toxic to you, remove it. That's just a simple thing. And not to be harsh, but you want to be happy, right? And you want to take care of your emotions, because your emotion will also affect your thyroid big time. So toxins, lifestyle, nutrition, supplements, environment, mitochondria, inflammation. There's so many things that you can, attack from different directions and really help your body and your thyroid heal, as well as your gut and gut health, brain health. Everything is connected. So via the vagus nerve too, actually. But take care of these things and your body will thank you. So a couple of patients, and I have a lot of patients who have gone through my programs and have been through acupuncture and supplements, nutritional changes, and it's really, really been helpful. Excuse me, but for example, Vanessa, and she had been diagnosed with hypothyroidism, and of course she had weight gain, fatigue, brain fog, not brain dog. That's a typo. Night sweats, dry skin, anxiety, and of course depression and cold and all these symptoms that are just debilitating. And then of course they put her on levothyroxine, which is the synthetic, T4, which is the inactive form, like I mentioned, of the thyroid hormone, which didn't really help her. So she still experienced bad PMS and digestive issues along with everything else. Surely nothing helped. And she came to me and we got her a wellness panel for testing and comprehensive thyroid panel. And then we found out that her thyroid antibodies were high and cholesterol was high. Her iron is low, her vitamin D was low. So that's another big thing. You want to make sure your vitamin D is proper levels. You want to make sure it's at least at 50, not 30, 50. 50 to 70 is ideal ranges. So I always check the vitamin D for patients to make sure it's properly functioning and properly leveled, because if your vitamin D is low, you're going to have more inflammation and more bones, joints, depression, different things, right? So after we find all these out, we started her on acupuncture and supplements, got her off coffee and soda, and got her on probiotics, of course, because you got to take care of the gut, and other supplements, as well as nutritional protocols. And she started feeling better quickly, and then her symptoms diminished and improved overall. That's one. I'm really grateful I can do that for patients too. And then Sophie also struggled with fatigue and weight gain for years. She tried every diet, every weight loss pills. As I mentioned, these are very, very bad, can be detrimental. And she used to lose a few pounds here and there, but nothing really lasted. And then she exercised regularly. Her diet she thought was perfect. But she noticed that she, kept gaining weight. Her hair was falling out, foggy headed, and so on. And so I did a thyroid panel as well. And lo and behold, of course, she had an autoimmune thyroiditis, Hashimoto's. And then autoimmune thyroiditis is, like I mentioned, your body attacks its own glands. So your thyroid is being attacked by your own body. And so, because it thinks it's a foreign object. And so it wants to attack it, right? But it's not. And that's what an autoimmune disorder is, when your body attacks its own organs. And then tries to destroy it. So basically, after her own standard thyroid testing that, they never tested for it, when she came to me, I did that testing. And then she's been in that state for a while. So she came to me, we did the testing, we did the nutritional, same thing again. Of course, the chronic stress that she had, we had to change that a little bit and make sure we addressed it. Cortisol, of course, was out of whack as well. When you wake up in the morning, you want to have proper, and the morning time should have the highest cortisol levels, right? And throughout the day, it should lower. And when you get to bed, it should be the lowest. It shouldn't keep you up at night. Cortisol levels at night should not be high. It should only be high in the morning, and throughout the day, it should lower. So if it's off, definitely come see me. I can help. Of course, her other hormones, progesterone was low, and basically it was a mess. So she also had food allergies. So after we did all these tests and found out the root cause, we treated her, and she was able to reverse and lost weight and felt better. And so really, again, grateful I could have helped. So the bottom line with this is, as I mentioned, your thyroid is a central organ. It affects and handles your hormonal behavior and production. It's the most essential gland for your metabolism and hot, cold, and energy and everything else. So as I mentioned, two factors that play a huge role is your nutritional factors, right? And eating habits, which is key, as well as you got to find the right professional thyroid doctor or functional medicine practitioner that can get the proper testing and can really help from the root cause to find what's going on. And then the other things I've addressed, like the environmental toxins, emotional health, and everything else. Hypothyroidism and hyperthyroidism are definitely both crucial and always need to be addressed on time. So if you do feel something, do not delay it. If you feel something, it's likely been there for a while, but still possible to reverse. So make sure you restore your gut, get to proper testing, get on a healthy diet. Also know that it's not a quick fix. Thyroid and hormones can be a little bit of time to take, to really help from the root cause, to really help change it. But it's worth it, and it's definitely not attained overnight. So you have to be patient, and you have to take the right measures and attack from every direction to really properly take care of it. Okay. So, so for the last 45 minutes or however long we've been here, about 40 minutes, I've been going over this whole idea about the science behind the thyroid imbalance and shared some examples. And I want to definitely help you and whomever you know that can use the help. And so that's why I'm here. And I'm going to invite you to work on me one-on-one and to really find out what's causing these stubborn symptoms and find out the root cause of these hormonal imbalance, and check your lifestyle, the chronic stressors, what you're eating, what you're doing, your labs, your sleep habits, your emotional, everything. And little things can make a big change. So I hope you took some information away from this. And of course, we have some testimonials that I want to share too, from patients who've actually done my Vibrant Glow detox programs and have gotten acupuncture as well. They do feel better and sleep better. And, you can read this, but they always start with a cleanse. And that was the key to really get them in the right place. And a detox, of course. Most people I see also have gut issues, even if they come in for injuries and they have a headache or whatever it is. Gut issues can be a big deal and the root cause of it. So always take care of it completely, and you can recover and really feel better. So this is how, and this is what I would actually like to offer for you here. So I'm going to broadcast this little button on the right that you're going to see, and I hope you can see that. I'm offering free 15-minute calls with me so we can really to see if you are suffering from anything and if I can help you figure out what's going on, and then see how I can, guide you better. So if you can press on that green button, you can book a 15-minute free call with me. And this way we'll get an idea of what's going on with you and your health. And once I get an idea, I can definitely guide you better. And I have different programs, different nutritional supplements and nutritional programs that can be really great and very helpful. As I said, it's 15 free minutes. So take advantage of it, get on a call with me, book it. And then, of course, I want to make sure we're a good fit to work together. So, I can help you and you're interested in it and you're open to being healed. And so definitely press on that, book it. The link is also in my bio, which is on my Instagram. And my Instagram handler is at Dr. So dr.Hadar Sophia. Here, I'm going to actually add that here. My IG is, and that link is also on there, and it's also on my Facebook if you're on my Facebook. But it's, I would love to help you out. I would love to chat with you. And once we actually do match and we work together, we can then take the proper steps. So we'll do a case review. So I order labs and we do a 75-minute case review after we've analyzed the lab testing and we fill the questionnaire, your health questionnaire. So we do a lab testing, find out the root cause. We talk and then we address the root cause. And then we do programs of nutritional supplements, nutritional changes. And these supplements are pharmaceutical grade, they're high quality, they're excellent. And then, of course, we do lifestyle, mindset. You get weekly calls with me. You get your supplements all covered. Basically, you get me for a month long or however long is needed to really help figure out the root cause and treat it. And so would love to help you. I've helped a lot of people and it's my passion and I know how to do it because I've done it for myself and many others. And there are many different ways to do it. And you have to really, like I said, I always do this because it's like attacking it from every way and not just one way. And I can guide you better. So I'd be so happy to do that. So feel free to click on that. And if you can't find or if you can't click on that link, there is this link, but it's also online. And I will post this video on my social media as well. So you can see it and it will also be on YouTube. It will be everywhere posted. So feel free to contact me. My email also, thank you, Francine, and you're welcome. You can also email me. At Dr. Hadar at thevibrantglow.com. You can also visit the Vibrant, I'm spelling it right, vibrantglow.com for any more information or questions. And I'd be so happy and honored to help. So any questions, please feel free to type in the chat box. We'd love to hear from you. So feel free to type in. Here to answer. I'll give it another minute or two. And then if no other questions, then I will thank you, but I will wait for that. Any questions? Anyone? Yeah, so feel free to book with me the 15-minute complimentary call, and I'd be really happy to help you out and be there. So the best way to fix, that's a great question, Francine. Thank you. And thank you, Al. Absolutely. The best way to fix a high cholesterol, of course, is nutrition and exercise, but you got to find out the root cause of why you have high cholesterol. So again, if it's a thyroid problem, then you definitely want to fix the thyroid. If it's not a thyroid, if your thyroid is functioning well, then you definitely want to cut back on. You're not going to be happy to hear that, but chicken and meat, red meat especially. Chicken as well, even though it's white meat, it can still cause plaque in the arteries and cholesterol. Make sure you exercise and eat a lot of celery. Celery is such a great friend to have. Should be one of your best things to actually eat because it really helps clean your arteries. There are other supplements that you can take. Make sure your good fats, the HDL, is high versus the LDL. So always bring your good fats higher. Yeah, celery juice is great. Definitely eat make sure when you juice it that you don't throw away the actual sivim, the fiber. Make sure you eat that, okay? So you can make snacks with those. Celery, the whole celery, not just the juice. Okay, good. Yeah, so there are different supplements, but make sure you increase your HDL to decrease your LDL. If your HDL is higher, you're in better shape. And yeah, don't throw it away for sure. Keep them and eat them. I actually blend in a Vitamix every morning after my workout. So I do chlorophyll. So my favorite is liquid chlorophyll. Chlorophyll, celery, and lemon with the peel. Right? So I wash the lemon, make sure it's organic. A dash of Himalayan salt, which is really good for you too. Can't spell, wow. Himalayan salt. Wow. And what else do? I do a little bit of either like fresh squeezed grapefruit or a little bit of orange juice fresh squeeze, just for the taste and also because it's so nice. And water, a bunch of water. And so celery, chlorophyll, lemon or lime with the peel because the peel has so many benefits. So I do that in the Vitamix, right? And that's one of the best things to do. But yeah, supplements, fish oils, CoQ10. Make sure you take CoQ10, right? Because that will protect your heart and also your arteries better, your mitochondria. And it's just it's a great supplement. So yeah, you're welcome. But otherwise, I have all these vitamins and I have all these answers for you. If you have more questions, I'd be happy to answer. Schedule that call with me if you like, and share this video that I will be posting with others because there are so many people out there that need this information and are lacking it. So don't hesitate in sharing. If you have questions, please do contact me. Don't hesitate contacting me. Okay. Any more questions? Okay, I think we're good. So I really appreciate you joining me today, and thank you so much. I am really happy to have been here, and thank you for your time. And I will see you guys in the next webinar, and have a wonderful evening and stay healthy. Thank you.